We are.
All right. Hello, everyone. I'm Dr. Matt Miller. I am a breast imaging radiologist at Allegheny Health Network in Pittsburgh. Thank you for joining us on this inaugural SBI Summer Series webinar. I'm just going to introduce the series briefly, talk about what we're aiming to accomplish here, and then I'll introduce the panel, or I'll let the panel introduce themselves, and then we'll get into the discussion. So this series was kind of a joint brainchild between the social media committee members of the Society of Breast Imaging, and it just a weekly webinar series to cover kind of the variety of different topics of breast health and cancer prevention. It's going to happen every Monday, most Mondays at 6 p.m. Going to be broadcast live on YouTube and Facebook, the SBI's official sites. There will be recordings of these sessions, and they will be posted on the sites following the conclusion of these webinars. They will be posted on the sites, and there will be a schedule listed on the SBI Facebook site. We're working to get the schedule posted on the actual SBI homepage, but that's kind of a work in progress. The topics, like I said, are meant to cover a wide variety, and the target audience really is anybody who's interested in breast health, from patients to family members to healthcare professionals along the entire spectrum of training and specialties, from surgeons to nurses to oncologists to therapists. There's going to be topics in this series this summer that will hit pretty much everything, and you should be able to get something out of each one of these sessions. Now, some of them are more geared to different audience members than others, but if you check the schedule, you should be able to find at least a few webinars that are of importance to your interests, as long as your interests involve breast health. With that being said, today we are lucky to have two other breast imagers. And another thing I want to say before we get to introductions is there will be different members of SBI presenting or discussing at each one of these. You'll see some people show up a couple of times, but there'll be a different kind of cohort each time. So you won't be seeing my mug every single time you log into this. I'll be on a couple of different discussions, but there'll be a different moderator each time. So I think that's important to get variety in the voices. I'm honored to be the inaugural host, or the moderator, as it were. But now I'd like to have the other panelists introduce themselves, please.
Okay. Hi, I'm Dr. Nina Vincoff. Like Dr. Miller, I am a radiologist specializing in breast imaging. I'm the chief of breast imaging for Northwell Health, which is the largest health system in New York. And I'm speaking to you right now from New York City. I also have a particular interest in patient experience, and within our Department of Radiology, I'm the vice chair for patient experience. So I love talking about the places where breast imaging and patient experience kind of come together.
My name is Jill Zhang. I'm also a radiologist. I actually just finishing up my residency, and I'm gonna start my breast imaging fellowship at the University of Pennsylvania. I'm very glad to join all of you guys today. I'm very passionate about patient care, and hope to be able to answer some of your questions.
Hi, I'm Dr. Jean Kunjummen. I'm one of the breast imagers here at Emory School of Medicine. I am a site director for the breast center at Emory University Midtown Hospital. And I'm excited to be participating in this forum.
All right. Thank you, everyone. The format of this discussion really is open-ended. The topic today is, why is screening important to return to in light of everything that's gone on in our country with coronavirus and COVID-19? We're seeing that breast centers are opening back up and starting both screening, and with that comes an influx of diagnostic studies and diagnostic procedures. A common question amongst patients and other healthcare providers really is why is it important with all the stuff that's going on with COVID? I think that, in the spirit of this discussion, I guess we can start there and answering, short form or long form, the question at hand. Why is it important to return to screening? Does anybody want to start?
I can start. I don't think it's any less important now to have breast cancer screening than it ever was. I mean, I think, we all believe that breast cancer screening is very important. Having annual mammography starting at age 40 reduces your risk of dying of breast cancer by 40%, and that hasn't changed. I think the messaging, has been complicated and confusing for our patients, for the women that we serve, in that we were telling people for a while not to come in. And we weren't telling them not to come in because we didn't think mammography was important. We were telling them not to come in because at the very peak, at the beginning of the pandemic, we were really focused on taking care of very sick patients, and also of sort of planning what our pathway was going to be forward so that we could create a safe environment for patients, for our staff, so we could get the right resources. But mammography didn't become any less important or less critical, I think, as an essential part of women's health maintenance.
Yeah, I think that's very well said. I can also share a personal experience. Like my sister-in-law, when she was 40, that was during her first mammo screening, she was diagnosed with breast cancer. And then if she didn't go to see the doctor, she wouldn't know, and she would miss the window to have an early treatment. And also I feel like sometimes patients are just concerned about coming to the hospital, but actually right now, our volume has been much less as compared to before. And also all the institutions has been implement strict social distancing. So we are actually scheduling patients on specific time slot. So before we take walk-in screening, now we don't take walk-ins anymore. So it's actually very safe because we all have different measures that we put into place to make sure everyone who walks in the door get the best care.
Absolutely. I mean, that actually is a great segue, Jill, into, what I want to talk about next. What are some of the measures that we're doing right now to ensure patient safety in the current climate of COVID? Because, everyone is aware that, hopefully we as a country have quote unquote peaked, but the threat is still out there. And that doesn't mean that breast cancer stops happening. Breast cancer doesn't care if there's a virus or not. Breast cancer is still there. And so, I think Nina hit it head on, right on the head that, it was never not important to get your mammogram. There was just some other things that needed to be taken care of that took priority for a couple of months. And now that, we're starting to get back to, in Pennsylvania, where I'm at right now, they have a color scheme, and where I'm at, Pittsburgh, is quote unquote green, right? And so green, is kind of, they're considering it the new normal. And so with that doesn't mean that it's back to what it was before, but breast centers, along with, other public domains, restaurants, entertainment centers or whatnot, everyone needs to take precautions. And so I know for us at Allegheny Health Network, we've, mammograms used to have 15-minute time slots. We've increased that to 30-minute time slots. There's a mask requirement. Everyone, there's increased sanitizers throughout the whole, you can't walk about 10 feet without seeing another hand sanitizer center. There's increased demand for, it's now required that you have eyewear protection. There's lots of different things in that sense. Can you guys speak to what your different centers are doing in addition to some of the stuff that I just mentioned?
Sure. For us at Emory, we actually screen every patient at scheduling to make sure that they don't have exposure to COVID or have COVID symptoms. And again, so that's one of the important things. As you said, Matt, we spread out our appointments. So similar to you guys, we have like 30-minute slots instead of the 15-minute screening. And what we did was to extend the hours from early morning to to evening hours. So we extended the hours to accommodate the patients. And definitely, like, we want to everybody is required to wear masks, both patients and the technologists and the radiologists. And one other thing is we never used to do it that often, was like, if we're trying to do like same day biopsies, if we can, to so that the patients don't have to come another day for a biopsy appointment.
Absolutely.
Yeah, well, it sounds like we're all doing very similar things. And those are the same kinds of things that we're doing in our health system. I think it's really important, in addition to doing those things, what I've learned is that the optics are very important. I think for patients to not just be safe, but also feel safe, it's really important that they are aware of what you're doing, that they see what you're doing. And so even though we were, of course, cleaning our equipment in between every patient, we now have our exam rooms marked clean so that the next patient that comes in sees the evidence that we've cleaned that room before they came in. I think, having, Purell around everywhere, having wipes for people who want to wipe their chair off, even though it's clean, who want to be able to have some control over their environment. I think it's important to not just make people safe, but actually make them feel safe. And so finding that place to make patients feel comfortable enough to want to be in the office, that's a whole nother challenge. Cleaning is easy, but making patients feel comfortable that it's clean and safe, that can be a little bit more of a challenge.
That's such a great point, Nina. It's definitely one thing to be safe, and there's a lot of things that go on behind the scenes that patients may not understand, or not understand, but may not realize that we've been doing for so long. It's not like whenever before COVID, and you had a biopsy, it's not like we just put the next person on the biopsy table and we're ready to go. Everything has always been clean, quote unquote clean. It's now important in light of today's culture and today's climate, that absolutely you got to feel safe. With that being said, if you're a patient and you're concerned, you got the fear of God in you about going into places about coronavirus, now you're getting calls to say, hey, you're due for a screening mammogram. Is there something patients can do to ensure that their given healthcare facilities are taking the necessary precautions?
As a patient, sometimes myself, since I also go for my annual OBGYN and screening, I actually got an email from a big institution, and it just listed that, right now they are taking patients, and those are all the precautions that they're taking to make sure they ensure social distancing. So I think that's very assuring. Because if you see, for example, if you see your primary care at one place and you see your OB at another and your mammographer at the other place, then the place who sent you that email probably would got your attention, okay, this is what they are doing right now. So I think doing some patient outreach at this point probably is also important. So because patients sometimes, I also looked some of the online forum posts, Absolutely. They are very nervous. They are very nervous of coming back because they also had breast cancer before, and they are very they are more, they may have more likely to get coronavirus. So I think those assurances are very important.
Yeah, I agree. I mean, I think we reach out to patients a lot in breast imaging and in imaging in general. We send them reminder letters or maybe phone calls, or depending on where you are, maybe a text message. I think every opportunity that we have that we're reaching out to a patient is an opportunity to remind them that we're doing whatever the things are that we're doing to keep them safe, whether it's on your website or, wherever it is. I don't think that people can be reminded too many times right now that we're taking these precautions. I don't think they can see it too much. I don't think they can hear it too much. People are still really uncomfortable. And I think we have to overdo it in our messaging. There was a lot of really strong messaging that went out in mid-March about don't come in. And I think we need to really overdo it in our messaging now to make it very clear that it's safe to come back. We need to undo probably some of the messaging that came from us to make it clear that it's not just safe to come back, it's important to come back. It's important for your health to come back. And that's on us to get that messaging out there.
Absolutely. And with that being said, with healthcare facilities, trying to go above and beyond to make it known that, it's safe to come back and, it's important to come back. There are also certain things that patients can do personally. Everyone knows about wearing the mask, right? But patients can do things not only for themselves, but for their fellow patients to make sure that, yes, the healthcare facilities are making things safe from their standpoint, but then patients also have somewhat of a responsibility to keep things safe as well. Can we speak a little bit about that? What methods patients can use when they know that I have to go in for a screening mammogram? What methods they can use to make sure that, they keep things safe, not only for themselves, but for their fellow patients, for their their physicians, for their other healthcare workers that they may come in contact with?
I think first and foremost, if you're sick, don't come in.
Absolutely.
I think both for everywhere, but both for in the workplace for those of us who are working in healthcare facilities, as well as for our patients, the days of being a hero and coming in when you're not feeling well, those days are over. Although I think we all agree, and we can talk about it some more, that a slight delay in your mammogram, is safe. We don't want people to wait for a year to come back. We don't want to see you in our office if you're sick. And I think you also, like they say, my mask, protects you, your mask protects me. Like, I think if you're going to walk into a healthcare facility these days, I think that you need to understand that the mask that you're wearing is to protect the people around you. It's partially to protect you, but we're a community of mask wearers, and that's how it works. The way it works is that your mask is protecting the people around you. And so I think it's really important, even if you say, I'm not really worried about COVID, I don't think it's something that I need to be concerned about. The people around you do need to be concerned about it, and we as a community as a whole need to be concerned about it. And so I think you need to have a willingness to do what's going to keep.
Oh, I think we lost Dr. Vincoff. Nina, you still there?
There. I'll let you up while I fix my audio.
Okay, no, you're there. You're there. We got you. You're back.
Yeah, I think that fact other is very.
Nina, you're breaking up again. I can take over. Can everyone hear me?
You're losing me, huh?
Yeah, Nina, you're kind of coming in and out.
I can. Yeah, I think that was a great point. It's just like, be aware if you are sick, stay at home as CDC recommended, and also wear masks. I think just all the recommendations from CDC, make sure you do the same every day. I think it's very hot right now. Sometimes people don't want to wear masks, and it's not easy to get one sometimes for certain people, but you just have to be aware. It's not like when the case number is going down, it doesn't mean like we can be less careful. We still have to follow all those CDC guidelines each step of the way in every aspects of our life, especially when you come to the hospital, you have to be interacting with people.
Absolutely. And I think that kind of goes back to what we were talking about before. Not only are precautions listed at these different, at your given healthcare facility, if you go on, every website for a healthcare facility has, big bold letters, COVID, on the homepage of each facility's website. If you click on those not only is it our responsibility to show, like Dr. Vincoff said, show patients why, it's important and what we're doing to keep them safe, but it's also important for healthcare facilities to either link to the CDC guidelines or have listed somewhere, this is what you should do too to keep things, safe for not only you, but for others. And Nina kind of touched on it a little bit, but with these, the current climate of things, and people are going to be wary, even if they are, they know that they need to get their mammogram, and they know that precautions are being taken. Why is it? What if a person comes to a breast imager or comes to a healthcare provider and says, I was due for a mammogram in March and you guys canceled it. Why do I need to come back now? Why can't I just wait till March 2021?
I think we definitely have evidence in the literature. It's very important to do annual screening. And even though there are definitely societies who, recommended, you can do every 2 years,
we won't
but
talk about
that's not what supported by the literature. Especially with TOMO, we can really find small cancer, even like small invasive cancer. So I think because also back in March, we wasn't sure how bad it's going to be. So the hospital really also have to reserve all of the masks, gowns, and everything for those COVID patients. I think people are compromising their own health for the other people's health at that point. Now it is really the time to take care of yourself. So now, and also even if we have a second wave, then that would be down the road. So right now it's actually, I tell my family members the same thing. If you need to see the doctor, go now, because this is actually a good window, good time to go. And there are not as many people. And also we are very well prepared for this right now.
Absolutely. Jean, do you have a comment?
Yeah, Jean, do you have something? She's on mute.
I think she might be on mute. Jean, you're on mute.
Yeah, I agree.
There you go.
I agree with Jill that the whole the Society of Breast Imaging and the ACR and the American Society of Breast Surgeons, they all suggest it's the annual screening mammogram that saves lives, and there's so much evidence that showed that it affects the mortality and morbidity. So even though it was a public health issue for that period of time, like 3 months, but since now, like almost all of the states are going either, almost going down, it is actually the best time for the people who got canceled to get it rescheduled and get it done. So I definitely, even when I talk to the patients too, I usually tell the providers the same thing, that this is the best time that they can come back, and let's all work together to get those patients back.
I agree with your point about the morbidity. It's not even just about saving lives, right? It's about finding cancers when they're small enough that they're easier to treat. Maybe they're going to require less invasive surgery. Maybe they're going to require less chemotherapy. So it's not even just, it's certainly about saving lives. And we absolutely have the evidence that annual mammography is going to save the most lives. But I think also we have the evidence that having your mammogram every year instead of every other year, instead of skipping this year until maybe COVID has passed us, you run the risk that we're going to find your breast cancer when it's larger and more difficult to treat. And that can be just as important as the life-saving aspect of mammography.
Absolutely. I mean, and kind of looking at it from a reverse standpoint of that. So we've established that, yearly annual screening mammography saves lives. And we kind of put that, not saying that we disagreed with that at all back in March when we decided to, shut it down and, take care of, the acute problem in our country. But now that we're kind of ramping things back up and we're saying again, no, you need to get your yearly mammogram. Okay. If you were due in March and, now it's June and you're trying to get a yearly mammogram, and does that make a patient more likely to have breast cancer? Did that 3 months cause that patient? So say a patient comes back in, comes back in June, was due to have a mammogram in March, and is found to have breast cancer, because that's bound to happen, right? The statistics will tell us that that's bound to happen. There's, someone out there who has had their mammogram delayed, and there's a breast cancer that is found on the screening mammogram. Did that delay cause that patient to get breast cancer?
It didn't cause a patient to get breast cancer. And I think most breast cancers, as we know, grow very slowly, but there are going to be some patients that might have been able to have their breast cancer found sooner. And I think this is a really good time to remind people that even if you're in a place that you can't get an appointment right away for your screening mammogram, if you feel something in your breast right now, you need to come in right away. So, and that was true even at the height of the pandemic. I don't know about the rest of you, but where we were here in New York, even at the height of the pandemic, if you felt a new mass, new, pain, focal pain in the breast, new discharge, a new symptom, it was common right now. And I think that that's still the case. So, most breast cancers are going to grow slow, but for those that come up quickly and for those that come up as something that you can feel in the breast, I think it's really important for women to know that that's not the same thing as a screening mammogram. A screening mammogram is for someone who doesn't have any symptoms. If you need what we call a diagnostic mammogram because you have a new problem, a new lump, you need to get in touch with your doctor and make sure that you get seen right away.
Yeah, I agree with Dr. Vincoff that, it is, if you have a lump, you want to definitely get it sooner, like ASAP. It's, even with when we had the COVID shutdown, we took care of all the patients with a new lump and new clinical symptoms. And it is interesting to see that even just in my breast center itself, like in just that 1 week, out of all the patients that had clinical symptoms, that how many percentage, ended up being cancer. So it was, it was not, as Nina said, it's not just the, we're not just talking about the screening patients, but when you have a symptom that definitely needs, attention ASAP.
Yeah, it was really strange for those couple of weeks where we, normally for breast imagers, I'm sure you all feel like this, most of our patients are normal, right? I mean, most people come and have their mammogram, they come and go. And we had a couple of weeks there where, because we weren't seeing the routine screening patients and the only people coming in with symptoms, the percentage of the people that we were seeing who really had serious problems was something that was unusual, I think, for a lot of us. That just was not something that we were used to seeing. The ratio was really off from what we're used to seeing during that period of time.
Yeah,
Correct.
it happened at my place as well. Especially now, sometimes people still come back because, they might be maybe high risk, or so I think we really have to also encourage those average risk women to come back as well.
Yeah.
Absolutely. I mean, that's, those were, like you, I'm glad to hear someone else talk about that, because those are some bad days. Cause I mean, people, you didn't have any callbacks because we weren't doing any screens, but we had diagnostics. People were coming in with symptoms, and a lot of them, we had a disproportionate amount of people in a day that, looked bad, and it was because they were all symptoms. And, that doesn't take a back burner now that we're ramping up our screeners. If you have symptoms, you still want to come in. It's still safe for you to come in and get checked out. That, we're not saying that that's any less important than it's been this entire time. I'm pretty sure most breast centers, if not all, kept that part of breast imaging open. What we're talking about now, what we're trying to emphasize the importance in this webinar is, while that, the diagnostic or the symptomatic side is still important, it's also important to get your screening mammogram. And it's now safe to do so. We've the Society of Breast Imaging and the CDC as a whole has deemed that it is now safe to return for these routine annual screening mammograms, because it will save your life potentially.
Not even just for the screening mammograms, right? I mean, if you're a high-risk patient, but you're not having any symptoms right now, and the recommendation for you is that you're supposed to be having not just mammography, but MRI every year, that MRI is not something that you should skip this year either. Just like you shouldn't skip any of your routine health maintenance. You shouldn't skip having your blood pressure checked, or if you're diabetic and you need to have that controlled, or your cholesterol. All of these things, they were on pause, but they weren't on stop. And
I like that.
the pause button is turned back off now. And we have, I assume, and I think we all do, that I don't know how much longer COVID's going to be around. A year, 2 years, I don't know, but it's not going to be here forever. At some point, this is all going to be a memory. COVID's going to be gone, and we need to be taking care of all of our other health issues. Women need to be taking care of all their other health issues so that we can all go on and live healthy lives after this virus is a bad memory.
Yep.
That's how I try to think about it.
Yeah, I think that's a great analogy. It's like, it's like a pause. It's not like a stop button. Now it's time for.
I'm going to use that. I love that.
Yeah, I love that too.
Yeah. Well, that's what they called it here in New York. Is that what they called it in other places? Here in New York, we were, that's what Cuomo says. So here in New York, we were on pause. Yeah. So now we're coming off pause. So
you guys use the stop and go, or you guys use the pause and stop or whatnot. PA, they use the traffic light. We were red for a while, then we went yellow. Now we're green. And,
you guys were stopped. See,
yeah,
we were never stopped.
We had a stop sign up. Oh man,
we were just on.
Well, is there anything else? That's all the kind of the topics. I think we've covered a lot today. I know it's only been like a half hour. Is there anything else that we should be discussing here? I think we really ran the gamut of why it's important, to return to breast centers and get your screening and what is being done to keep things safe for you and for us as healthcare providers, safe for everyone. If you don't know what's going on, ask people, get on the internet and look up, if the internet is the websites are confusing or you're not finding the information you need, make a phone call your healthcare provider, ask them, hey, what are you guys doing? What should I be doing? What should I, where should I go to make sure that I'm keeping myself and others safe? What are you guys doing to ensure that you're keeping me and all of your other patients safe? Now is not the time to be shy. And
absolutely.
I think that with that in mind, I think we can safely resume what we were doing before COVID, volumes that we were doing before COVID. It's not going to be the same style. You're not going to be sitting in a waiting room with 10 other people, watching, whatever's on daytime television now and reading magazines. You're going to be sitting in empty waiting rooms, but at the same time, we can still, with the precautions that we're taking, with the changes in schedule and whatnot, we can still get to the same volume that we were getting to pre-COVID. And it's important for you to make your appointment to get your screening mammogram to get in with that.
Yeah, absolutely. I think it's just really right now a great time, and we should all encourage our patients to come back. And if they have questions, we are always here to answer those questions and help out.
Yeah, I agree. One other thing is I'm in Atlanta, so we do have a lot of African American women. So we all know that breast cancer has devastating impact on African American women. So especially if you're African American, I definitely encourage the women to go back to screening, to have screening mammogram.
Great. Great. And doing all the other things that we were recommending before this, talking to your doctor and finding out whether you're in a high risk group, those, all the things that we were recommending before this started, those things need to happen again. Like I said before, this COVID thing, this is going to pass. Yeah. So we got to be thinking long term now, not short term. We got to, back on track for the long term.
And to piggyback off of that, Nina, I mean, we're breast imagers, and so that's what we know, right? But we're not naive in the fact that we're the only people that are opening back up. And so, go, like you mentioned before, go get your blood pressure checked if that's what you need to do. Go get your colonoscopy if that's what you're scheduled to do. All of these things that are opening back up are important. We can't speak on, the importance and why they're important or whatnot, but you have to trust your healthcare providers. They know what is important for you and why it's safe to go back. And, I think some of the stuff that we discussed today, the precautions and whatnot, can apply to other realms in healthcare, and what's being done. So I think it all just kind of goes back to, if you don't know, ask.
Yeah. Don't be shy. I'm using your line. Now is not the time to be shy. Most of us in New York are not really that shy.
Closing thoughts? This was great. We're good. All right. I think we all, had our chance to give our spiel, right? It's been a pleasure talking with you all. I think we went over a lot of great topics. Next week, we're going to do it again. And our very own Jill will be our moderator next week.
This was a great start to this series. It really was. Thank you so much for the work that you did to get this started and for being the brave first moderator of this series. But I'm really looking forward to seeing how this develops over the course of the summer.
Yeah, me too. I learned a lot myself as well from all of you.
Great work, Matt and Nina and Jill.
It was a pleasure, guys. I hope our audience, now I'm speaking directly to the audience. I hope everyone got something out of this. If you have any questions or concerns, please feel free to reach out to any of us. We're all on social media. We can't give official medical advice that way, but we can speak in generalities and answer questions for you. And this is in its infancy, really. This was kind of like I said, a collective brainchild of the social media member committee. If there are topics, if you look at, to the audience, if you're looking at the schedule and there are topics that you feel aren't well covered, that aren't listed, we're open. We have open dates. We can talk about, we have breast imagers on call for these meetings. We can set up something. If someone wants to submit a topic that you need discussed that isn't currently listed, that's open. So please, again, now is not the time to be shy. But I hope you enjoyed this. We'll see you all next Monday.
All right.
All right. I look forward to it. Thank
Me
you,
too.
guys.
Thanks, everybody.
Bye-bye.